Assalamu alaikum. I taught this topic today in the class and I thought that it is going to be a good idea to give you a sense of how the questions appear in your exams. So our theme today is going to be vaginal discharge and we'll talk about how vaginal discharge might help you reach a diagnosis. The discharge consistency, its color, its smell, etc. So the case would be that a 35-year-old sexually active woman complains of a thick white vaginal discharge with severe itching and irritation of the vulva. She also has burning micturition. At this point, it is a pretty much giveaway and you might have already reached the diagnosis. But we need to think that why this particular diagnosis is correct and why the others are not correct. She denies any extramarital sexual involvement and believes her husband also does not gets involved in any such activity. So this rules out any type of sexually transmitted disease she would most likely be suffering from. So before looking at the options, I want you to think of one particular disease which comes to your mind. Here are your options: gonorrhea, syphilis, trichomoniasis, chlamydial infections, and candidiasis. So you can pretty much rule out those which are sexually transmitted diseases. And if you have no idea of what it would be. So let's go see the answer, and you already know that it is candidiasis. But it doesn't stop here. Let's discuss what could be the case if I had given the question related to these. So if this would have been gonorrhea, the color of the discharge would have been different. It would be sexually transmitted, so that would have reflected from the history. Same goes with syphilis. I could have added a lesion like chancre and history, and there would be the discharge would not have been emphasized. It could be trichomoniasis. Again, the quality of the discharge would have been different. Chlamydial infection, the symptoms would have been different, and candidiasis, you know it. So let's move. So these are the differential diagnoses of the vaginal discharge. These would be slightly different. These could be slightly different in reality, but general features are these. So gonorrhea will have a thick yellow-brown discharge and an additional point of having gram-negative diplococci in gram staining, right? Chlamydia, a thin yellow-brown cervical discharge with additional points in the question you might get of the symptoms of the lesion. Then trichomonas, a thin greenish yellow and often frothy discharge with an unpleasant fishy smell. This fishy smell is kind of a particular pointer towards trichomonas, but bacterial vaginosis also might give you a fishy smelling discharge. So you will have to differentiate between these two. Generally, when we give trichomonas in the questions, we specify that a protozoan was isolated. And candidiasis, you already know that, a thick white colorless, a thick white odorless discharge. And that's it for today. Please let me know how you found it. If you like this idea, and we can then continue doing that for further lectures and maybe more questions from this particular lecture. Assalamu alaikum.